Hi, today's July 14, 2023. I'm Dr. Randall Bach. I'm honored today to be with Dr. Joseph Varon. Um, and he's an amazing physician, brave, courageous, smart. Tell us about what your efforts have been.
Yeah, so I'm Dr. Joseph Varon. I'm a professor of medicine at the University of Houston in Houston, Texas. I have my own private practice, and I have six different specialties, and apparently all of these specialties kind of blended together, especially during the pandemic. So I was able to do quite a bit of work. Actually, you probably know that I worked 715 continuous days during the pandemic without a single day off. Yeah,
Amazing.
that's quite a bit. I mean, not even as an intern, I worked so many days, and the only reason why I stopped at 715 days, at least for a couple of days, was because my daughter was getting married in Cancun, Mexico. So I had to go to her wedding. If not, I was no longer going to be part of the family. So I had to take care of things. But the problem is that I was working in a hospital that takes care of a lot of indigent people, communities of color, a lot of illegal immigrants, and nobody was caring for these people. So somebody had to take care of them. My unit got national and international recognition for our work because we were really having excellent outcomes and we were going nonstop. I mean, it was a very well known unit. We were featuring pretty much every newscast that you can possibly imagine, CNN, BBC, just whoever you want. We were part of it for the stuff that we were doing.
Well, that's amazing. So tell us what were the things you learned, and how was your wisdom able to be disseminated?
Well, I mean, I think that we learned on the go. I mean, we didn't know anything about this illness when it first started, and the one thing that was obvious is that there was a lot of misinformation. The president of the country would say one thing, then the WHO would say a different thing. The CDC would say something completely different. Dr. Fauci would say something different, and then he would change his mind 3 or 4 times. I would come out and say something different. So people didn't know who to trust. And the fact is, in all reality, we didn't know too much about the illness. But we learned very fast. We learned that this was a highly treatable illness, particularly if you treat it early in the disease. We learned that this was a steroid responsive illness, which at the beginning people thought that we were crazy because a group of us had come up with a protocol, with a clinical protocol, utilizing well-recognized medications that was working on patients. And they threw a lot of rocks at us, but our mortality rates were very low. I mean, my mortality rate at my hospital was like 4.4%, when the rest of the country was over 40% for the same level of illness that these patients had.
So what was the treatment, and why would people throw rocks at you?
Well, the treatment was the MATH plus protocol, and the MATH plus protocol stands for methylprednisolone, ascorbic acid, thiamine, heparin, and the plus sign were other things such as ivermectin and a couple of other things that we were using, magnesium, zinc, and similar things. Why were they throwing rocks at us? Well, for one thing, we were trying to spread the word about easy to find, inexpensive medications that have proven to be useful for decades for other illnesses. They were FDA approved, and we were using this when everybody else was trying to go for the fancy schmancy remdesivir and things like that. We knew they didn't work, and we knew it didn't work because we tried them. It's not like we didn't try all of these things. Every time somebody came up with a new idea, hey, let's use remdesivir for COVID, I used it, and we saw it didn't work. Somebody came up and says, hey, let's use colchicine for COVID. We tried it. They talked about the monoclonals. We tried everything. And what we saw worked the best was this inexpensive protocol. So we start having people, really go after us. I'm telling you that at some point it was so bad that I had death threats in my office. I mean, people would call my office and say that I was going to die, that they were going to shoot me down, that I was not going to be able to round the next day because we were doing witchcraft.
That's a craziness. Historically, medications have been repurposed all the time. We give aspirin for heart heart attack prevention. Aspirin was not that. It's an anti-inflammatory. Viagra was a repurposed medication. It was an anti-anginal. It got repurposed as a erectile dysfunction. Medications all up and down. I don't want to bring this up. It's a sore subject, but hair regrowth. Both medications, minoxidil, which is Rogaine, and Propecia, which is finasteride, are both repurposed, in this case, blood pressure and prostate medications. And I think that there's a secondary use for medication is age old. That's what people have always been doing. It's part of the discovery process. Why was it that people were upset in this particular instance of taking an inexpensive, safe medication? Mind you, ivermectin had won its discoverers the Nobel Prize in medicine.
I mean, that's a great question, and and it's a subject of a lot of controversy. I mean, some people say it's because big pharma was trying to make money. Other people say it's because the vaccines, and if you were to have some kind of treatment, automatically that emergency authorization goes away for the vaccines. So there are a lot of reasons. I mean, in my case, I would tell you, I was really getting people upset that what we were doing was working and what they were doing was not working. So they have to find a way to throw rocks at us. I have had patients. Actually, I had a patient that came to my office last week, and somebody told her that, because she didn't receive the vaccine, that she should die, and that anybody that followed the protocols that we came up with should go to jail. I mean, that kind of antagonism you're seeing, which is for the first time in the 40 years that I have been in medicine, I have seen. I have had different opinions with other of my colleagues for many years. I mean, that happens. But I've never had people that are so antagonistic that they're wishing you something really bad to happen. Never in my life.
No, that's incredible. They say you catch flack when you're over the target. That is when they start shooting at you, there's a reason they're shooting at you, because they're vulnerable in those places. They don't shoot at you if you're saying something harmless, or if you're in the street babbling like a moron. They don't shoot at you. They take pity upon you. So when you get this aggressive kind of actions against you, do you ever wonder who's behind that, and what are the rationales? And did you ever seek out or search out who is doing what for, why and for whom?
I mean, you want to do it, but sometimes there are so many things being thrown at you at no point. For example, I just literally had a new book just published and talks about what happened in our COVID units from the humane standpoint. And the first review that I see that somebody puts on Amazon says that we were doing experimental things and that we were doing whatever. I mean, it's like, really? And yes, I do ask myself why. Of course, the other 10 to 12 reviews that you have, all of them give me like 5 stars. But you wonder, why would somebody do that kind of stuff? Why would they write such bad things? It's like that person that says you can't be serious. Of course, I was serious. I was talking about what I felt, what was going on in my mind at the time. And it's funny because some of the reviews just actually start going after that person, whoever that person may be. And again, I mean, who is that person? What is going on as far as the long-term plans that they have? That's their thing. I mean, I still get offensive emails, letters, messages every day, every single day, for doing the right thing. Think about it. This is the first time in my life as a doctor where I'm trying to do the right thing. I'm trying to help patients. I was the doctor that was there when no doctor wanted to step a foot inside the COVID unit. In my hospital, not a single doctor would go into the COVID unit because they were scared that they were going to get COVID. So you had no cardiology, no endocrinology, no nothing, no neurology. So I was the one that was taking care of every patient nonstop. So, it's like, people just chill.
Yeah, lighten up. There was a terrible joke. It was by Senator, I think, Roman Hruska, back in the 1960s. They were going to the Rome to talk about, I don't know, there was a convention on birth control and whatnot, and this senator had a few drinks in him, and he said about the Pope, about birth control, he says, play the game, make the rules. And leaving that the joke aside, his point was that you're not in this. You shouldn't, no pun intended, be pontificating about this, because you're not part of it. I disagree with his sentiment, but in this case, it's actually apt. I mean, and plus, you're not nobody. These are let me just see if I can put these up here. These are some of your other books, and we're not talking about um, here the handbook of critical and intensive care medicine. Um, Joseph Varon. You have previously been an expert in your field, so it's crazy that people because it happens to be COVID in this case, acute and critical care formulas, laboratory values, and as well as writing challenges of the pandemic, practical critical care medicine. So it seems to me as if you have the bona fides to have made observations appropriately. It's hard to
And,
do actual science in the middle of a pandemic.
and
It's hard to back
and,
everything up. You have
and
to a little bit go by the seat of your pants.
in all fairness, it was not just me, Randy. I mean, it was a group of people. So the way this starts is like towards, let's say, February of 2020. I mean, we're starting to see cases. People are starting to get sick. So I lift up the phone and I call one of my best friends, Dr. Paul Marik, and I say, "Hey, Paul, what are you doing for these patients? Because I don't know what to do." Paul and I, we've had this relationship over 30 years where whenever he gets in trouble with a patient, he calls me. Whenever I get in trouble with a patient, I call him just to see what they're doing. And, we start coming up with a couple of things. And then he invites Dr. Pierre Corey. We invite Dr. Umberto Meduri. We invite Dr. Jose Iglesias. And we come up with a protocol. We come up with this Math Plus protocol. We formed the Frontline COVID Critical Care Alliance, the FLCCC. And, we start as educators educating people. I started going on television shows, on a bunch of things. I mean, I did from March 2020 until today, I have done close to 3,800 television shows, national and international. So we start spreading the word of what we're doing. We start spreading the word about COVID itself, how it gets spread. Some of us start going more into the political aspects of it. For example, Dr. Pierre Corey starts talking in front of Congress. It starts giving, information that needs to be preferred. Dr. Paul Marik goes and does an amazing scientific job. And, towards mid of all of this, we start getting hit by a variety of different, I call them insults, institutions that are going after us, agencies, government agencies, like the board of medical examiners of different states going after some of us for doing the right thing. This is incredible. I have never seen anything like this. I can understand, if I'm killing patients out there, if I'm doing something like that, go after me. I deserve it. But if I'm doing the right thing, why are you coming after me? And, always everything came back A-okay. But, the FLCC starts getting a huge push. A lot of people start looking at what we're doing. We become a real huge educational institution. We start, at some point in time, some of our protocols were translated to 23 different languages. So, it doesn't matter what part of the world you were in, we were showing what was going on. Some countries followed a lot of our recommendations. Others didn't. But what was more interesting was that the US, where all of us practice, was not following our main recommendations. I mean, just a percentage was following. And, from there, we evolved into not just talking about COVID care. FLCC has slowly grown and now has protocols for all sorts of things. Why? Because a lot of people want answers. They want to be educated in not only conditions such as COVID, but other conditions. And we are focusing a lot on prevention. We have realized that the current healthcare system has a lot of pitfalls, and it is time for us to help out the community. And maybe sometimes the easiest way to help is by getting the patients to help themselves, to prevent them from ending up in hospitals and stuff like that. So we're just being doctors, we're doctors being doctors. And the problem is that we were not being allowed to be doctors. That's the problem.
No, it's a gross problem. In California, I'm not sure where the bill is right now, but there was a bill, I think it was AB 2098, if I have the numbers and letters correct, which was going to be able to disbar physicians for having opinions contrary to the state. This is very redolent of the Stalinist, Maoist approach to science and medicine, wherein the state gets to determine medical truth, scientific truth, and so forth. And which, of course, that's an oxymoron. If there's a state science, then it's not science. If there's a state medicine, then it's not genuine medicine. People get their best ideas through debate and interaction and proving things out. You don't at the beginning of the year decide who's the best football team is and just anoint them. You have to play the games and you see who wins and who loses. And the best practices in football, the best practices in internet, soccer, football, or whatever sport you pick are from competition and through evaluation afterwards. And so this concept that, somehow people should preordain or decide what is the right course of action without having ever had such an episode is, on its face absurd. Let me ask you a question. This is, getting conspiratorial, but do you feel as if there was an effort from the powers that be, from the state, from the institutions, public health, CDC, et cetera, NIAID, to kind of keep the population treatment naive so that they would make a better formulation, a better test population for the upcoming viral preparations, vaccine preparations?
I don't know. I mean, this is I'm going to call it, that's a loaded question. I know that a lot of my colleagues would say yes. I know that a lot of people would believe in these, I'm going to call them conspiracy theories. I just cannot understand how we were able to go through this in such a manner. Nothing explains it. I know that, one theory is that the powers of being are just trying to do their own thing and they don't want anything that is, different than what they're doing to do it. I know the other theories that talk about money, just follow the money and that's exactly where you're going to fight. What concerns me is what you were mentioning. I came to this country because of the freedom of speech. I came to this country because as a doctor, I was able to practice medicine. And I understand, you should always respect patients' confidentiality. You should always respect patients' privacy. You should also respect patients' autonomy. But now you have an illness that is killing people. And we are, taking care of all these three things. And yet we're being attacked. We're being attacked for using quote unquote experimental medications. They were never experimental.
No, they're never experimental.
We've been using them for decades. I mean, what's experimental about them?
No,
nothing.
It's absurd.
Nothing.
Yeah, no, I never came down on the side whether HCQ, hydroxychloroquine, or ivermectin work or don't work at the time, because there were never enough data to decide that. But I did come out down the side that you have the right to try. In 2018, Donald Trump came up with a congressional bill, which passed, literally called the Right to Try bill. In this case, it's referring to terminal cancer patients. Rather than waiting for some drug to percolate down the FDA, phase 1, whatever, multi-step process, hundreds of millions of dollars, you're going to die anyway. You have the right to try the medication. And this goes back to back to the 1970s, the Laetrile controversy, where people were actually crossing the border into Mexico to get medications that they couldn't get here because they thought they worked. Now, if your life is terminal, I think you have the right to try something. And and in this case, not everyone was obviously terminal from COVID-19, but the severe cases, if people were in the ICU and they were near death, and there were some, whispers and practices of medications that were out there, FDA approved and otherwise safe, what is the harm? There is no harm. Medication, we say, for medicine, we have primum non nocere, which is Latin for first do no harm. And you have medications that are safe, and you have people who are dying potentially. I see absolutely no reason why these shouldn't be encouraged.
Correct. And, and again, when you're seeing people dying, I mean, that's what happened. I mean, I was seeing patients dying. And in all fairness, for example, I was one of those that received the vaccine. Why? Because I was seeing people dying. So I was trying everything. I went ahead and I put my arm before anybody else. I mean, now I wouldn't do it. But, at the time, I did it because things were going so bad. But at the same time, I was seeing patients dying. Then I was giving them something. It works. And now people want me to do a randomized controlled trial, placebo-controlled. That's unethical. I know that these patients are getting better. What am I going to give 50% of the other patients a placebo that I know it's probably going to kill them? No. That's
well, not only that, but essentially the other half of your experiment is being done elsewhere. So if Joseph Varon does this in Houston, if I have the city correct, and you do X, Y, and Z, and somebody else in Dallas or Austin is doing something else, you already essentially have your control episodes. There's you and there's everybody else. So if you have better results, so forth, you don't necessarily need to do it. And it's impossible to do the gold standard randomized, controlled study you're in the middle of a battle. So I actually compare you a little bit to a fighter pilot. So if you're having, a skirmish and it's the middle of war, you don't say to the pilot, the pilot who's been successful, he's managed to do, 50 sorties and he comes back and he does all his bombing appropriately. You don't say, look, now I want you to do it with one eye closed and I want you to fly backwards just to see if you were doing it the right way to begin with. So you've already been tested, and you can't do experimentation during battle.
Correct. I mean, there is no question. There is no question about it, and a lot of people don't understand that. That is the biggest issue that I see. I mean, I have the patients, I have the experience, it's working. Why am I going to do something else? Why am I going to give patients a 40% mortality when my stuff works at 4%? I mean, it doesn't make any sense. And again, we never really, none of us have any other, secondary gains. Nobody went in for the money. We were not in like, let's get.
Yeah, I don't think you show up 751 days in a row for the money. Even if we all like money. Money gets us things, so forth. But you could easily have taken some time off if money were if leisure, the money gives us leisure. If leisure were your interest, I don't think you would have devoted that time for it. And you weren't, you weren't making the next Amazon.com or whatever. You were helping people and you were putting yourself out there at personal risk, obviously. You look 25, but I'm sure you're not 25 years old. And so you were doing it at some personal liability. And I don't think people understand that. Again, I think the fighter pilot is a very good example. You're going out there, you're preserving your way of life, you're helping people, you're doing exactly the job you're supposed to do, and you're putting yourself at risk.
Yeah, and people don't take that into consideration. I mean, again, we were talking about this review in the book. It's like, really? I mean, were you there? Would you have been there and stay there for 751 days? Stop giving us that nonsense. I mean, and look at my friends. Many of my friends that were part of FLCCC, they lost their jobs. They were ridiculized. They were put in situations that you say, really? The people that are part of the FLCCC, the initial founders, all of us, the 5 of us, if you look at our resumes, our curriculum vitae, they're impressive. I mean, you have people that have anywhere between 200 and 1,000 published papers in peer-reviewed journals, each one of us. I mean, you are talking about the most published people in critical care medicine today.
Right.
And the people that are coming and they are going after us are people that either have never written a paper in their entire life or have no idea of what they are doing. I mean, so how? And it's funny because it hurts, and it really hurts. Some of us are very sensitive about these things. I mean, you look at Paul Marek, you look at Pierre Corey, you look at myself, you look at Jose Iglesias, Humberto Medori. We struggle because of that criticism, because we know that what we're doing is right, yet people came after us. People came after, our livelihood, which is to take care of patients.
I know they did it for Dr. Corey. Did he? I think he got defrocked in the state he was practicing. Am I right?
He had some issues, and Dr. Marik had some issues. I mean, I'm telling you, they are probably some of the best intensivists I've ever met in my life. I mean, they are really dedicated, caring clinicians, and yet people are going after them. That's nonsense. I mean, I look at the passion that these individuals have for caring for the patients. I mean, you can tell these are way above average, and that's the problem. Once you become way above the average, you bring the bar up. Mm-hmm. So these other people down here, they don't want to come up here. They don't want to, because that's a lot of work. So they're going to throw rocks at you. And that's what they did with us.
Yeah, in a sense, it's the politics of envy. I don't want to get political on this, but a fair amount of socialism is politics of envy. It's easier to get something by taking from others, and it's easy to think that others got something from ill-gotten gain. But in this case, it's more intellectual. I think it seems like it's an intellectual envy. The fact that you were doing it and you're willing to think outside the box. I think that threatens people's conceptions. If they have already totally purchased, the concept that was given them, they've eaten it whole, and then you show them something else. I think they feel regret, and they can't square that with their own psyche because they've invested so much of their psyche into proving that you're wrong. I don't know if that made any sense.
Makes perfect sense, and I think that you are correct. And the interesting thing is that it had nothing to do with political affiliation. So as you know, during the whole pandemic, I strayed right in the middle. Even though before the pandemic I had a particular political affiliation, during the pandemic and up until today, I'm right in the middle because I have seen nutcases on both sides of the equation. It's unreal. The things that you hear on the extremes on both sides are unreal. And instead of everybody working together towards let's help patients, everybody is going against one or another just based on your political affiliation. That's not medicine. That is not medicine. That's not what I signed up for when I became a doctor.
No, it's true. So this is really kind of a rhetorical question, but so how many HIV vaccines have you given?
None.
Why is that?
Because one, I have not seen a single HIV vaccine that is useful. And so that you know, I worked for many years with Professor Luc Montagnier, the guy that discovered the HIV virus. So I'm quite familiar with the HIV situation.
It's really a setup for my next question. Should people who had HIV, should they have waited for a vaccine or should they have tried therapeutics when they came out?
Of course, they should have tried any therapeutics that they could. And that's what we did. And, the therapeutics are so good nowadays that now you have people walking around with once a month or once every 2 months shots that keeps their viral load in nothing. It's impressive.
And just to reiterate, HIV stands for the human immunodeficiency virus. So this is a virus. We usually think of antibiotics for bacteria. So there's a medication that's going to keep this, it's not going to cure it, but it's going to keep this virus at bay. And so we've had for decades now, we've had very excellent medication against a lethal problem without a vaccine. And for some reason, when we had a similar situation, a potentially dangerous virus, especially for the right, when I say right, I mean the wrong demographics, elderly people with multiple comorbidities, not for everybody, not for kids, but for those people, it's a dangerous situation, and for some reason we're supposed to withhold therapeutics for them. Does that make sense?
To me, it doesn't make any sense. And again, I'm not an anti-vaxxer, but at the same time, if I have a treatment that works for patients, why am I going to go for vaccines?
Exactly right.
I mean, it's the whole thing, and I know that the vaccines have issues, lots of issues, and unfortunately, I'm seeing more and more of them. Actually, I'm now seeing a pandemic of post-vaccine injuries, unfortunately, in my office. Yet, like I told you, I was one of the first ones that got vaccinated because I didn't know what to do. People were dying. I would try whatever to avoid that.
Did you choose the brand? Did you make a purposeful choice?
I did not choose the brand. I got whatever I was able to get for me and for my staff in the hospital.
Okay. And so when you say you're seeing more vaccine injuries, how do you know that is what they are? And what type of categories do they fall into?
Well, I mean, it's fascinating that you mentioned that. I mean, the first thing is the only reason why you know that this is vaccine injury is because it followed the vaccine. Now, could it be coincidental with something else? Maybe. Now, what kind of categories? Just name it. We have seen them. Neurological issues, cardiological issues, rheumatological issues, endocrinological issues. It's like, people that were perfectly healthy out of the blue, you give them a shot and then now they have this new disorder. Now, it's not everybody. And unfortunately, I have no way to know who's going to get in trouble, who's not going to get in trouble. That was one of the biggest issues that we had. When people were dying, I didn't mind to be a guinea pig because that's what I think I was. I was a guinea pig, and that's okay.
Right.
That was my decision. It was a personal decision. Like I told you, I live in this country because of my freedom of speech and freedom of choice. So it was my decision. I said, hey, put it here because patients are dying. I want to see what happens. And as of today, I have never had COVID, believe it or not.
That's wonderful. I think, like I said, I think the vaccine, I'm not anti-vaccine either. First of all, I don't like the term anti-vax. I'm going to put that out there because I think that's a straw man argument. I think it's misrepresents what people's problems are. I've given out probably tens of thousands of vaccines in my life. I've taken dozens of vaccines in my life. I took the flu shot every year for decades. So I suppose that puts me on the pro-vaccine side, but I don't take every vaccine every day. I don't take I've never taken the yellow fever vaccine. because I'm not at risk of yellow fever. I'm sitting here in Boston, Massachusetts, and we don't have yellow fever. If someday we do, I might think about it, but I'm going to also weigh it against the risk, of the vaccine, the benefits, and so forth. It's not like there's ever been one size fits all for any type of medication for any problem anywhere ever. And so this concept, but even if you stipulate that it's the right choice for, say, an 85-year-old with comorbidities, fine, give it to that person. It's not the same as an 8-year-old with no comorbidities, and it's not the same as giving the vaccine when the problem has already disappeared and/or after you've already had the illness.
I mean, I agree 100%. I mean, there is no question about it, and I understand also, the issues that we have. Again, the pandemic was something that nobody has ever experienced. And we all went with, I call it wishful thinking. So you get this variety of people that says, oh no, this is a golden situation that is going to make things go away. So when you hear these things, when everybody's dying, whatever they tell you, it works because like I said, if I heard that remdesivir worked, I tried it. If I heard that whatever worked, I tried it. If I heard that the vaccine was working, I tried it. I gave it to my own family. You know how I feel after that? And it is a situation. Now, I would talk to my patients about vaccination, and I tell them, look, let me tell you the good, the bad, and the ugly. You make the decision. We sit down together, but I would never impose anything. And that's for all the stuff that I do with my patients. I would never impose anything on my patients, even on my patients that have chronic obstructive lung disease, the ones that keep on smoking. We had the discussion of smoking once or twice. I don't fight with them. I mean, it's like, it is your choice, but you need to understand what's going to happen to you if you continue to do this. I think that that's why we live here. That's why we are Americans.
Yeah, well, we're Americans, but things can change. Venezuela had a constitutional democracy, and they were the wealthiest country on earth in 1960. Well, wealthiest country in Latin America in 1965, and the fourth wealthiest country on earth in 1950. And things can change, so we have to keep an eye. And we have a vision of what the United States should be, but it seems that there are others who don't want that to occur. What do you think was going on that there was so much kind of repression and censure and censoring of people who went against their version of events?
I think this was just manipulation of information, simple as that. And I will tell you, I was the #1 prisoner on Facebook jail. I mean, I kept on going on Facebook jail because I would post whatever. I mean, simple things. I would even say, this is our new paper. For example, we had a paper that said ivermectin, its uses or stuff like that. I didn't even put the paper. I just put in a picture of the title. Automatically, I went to Facebook jail for a month. That means I was not able to post anything. I was not able to comment anything. It's like, why? I mean, I did not even say if ivermectin was good or bad or anything. So a lot of my colleagues, they were booted out of Twitter and a couple of.
No, it's crazy. You had to misspell words and you had to put them in backwards. Whatever, the censors, and even if you had photographs of your words, they figured out how to follow that. I spent a little bit of time as a visitor behind the Iron Curtain in the 1980s. Before the wall came down, I was in Czechoslovakia, Hungary, East Germany, Yugoslavia, and there was genuine repression there. You couldn't say or do anything that the state didn't approve. People would sit in the buses or the subways or on the street and only look down at the ground. They didn't want to have eye contact with anybody else because the state was watching what they think. And we seem to have entered some aspect of that. Medicine has always been both a science and an art. And I think you have to be able to practice things with a certain amount of leeway. And that seems to be, going, disappearing if the state gets its way. So on a personal level, did you have repercussions with any kind of state apparatus or board? Whatever?
No, I mean, I went and talked to them a couple of times because of my use of ivermectin and stuff like that. But they, I think that they were very reasonable. They listened to what I had to say, to the data that I sent them. Also, they recognize that there was no standard of care when all of this happened. As of today, there is no standard of care for the patients with COVID, and I think that it is very difficult to finger point to somebody for doing the wrong thing when there is no right thing. Nobody has established.
Exactly right. That's crazy.
So I think that's the primary thing. I mean, like I said, continue to get headaches every day, but I will continue to do this as long as I'm healthy. I'm going to continue to work as hard as I can to help my patients, because that is my priority. That's why I
You
went
know,
to
that's integrity. You know, we listened to Chris Martinson talk in New Hampshire a couple weeks ago, where you and I met, and you know, he says the thing that he takes home is personal integrity, and you know, be able to live with yourself, wake up with yourself, and so forth. Alexander Solzhenitsyn he died in I think in the 80s or 70s. He was a Russian writer, and he got sent to the Gulag. For saying what he thought, and he felt that, and he lived knowing that the state is a temporal thing. He lived under God, and you know, man needs to be measured by how his best purpose and best self is, not by what the state tells you to do. And so I think there's two categories of people who will accede to what they're told when they know it's wrong, and people who will not. And so I applaud you for that. I know your time is precious. Can you leave us with thoughts about how to proceed for the next emergency and event, and how did you get your bravery and forthrightness?
Well, I don't know how in the world I got my bravery and forthrightness. I think it's just, I had to do what's right for patients. How are we going to proceed on the next one? Because we're going to have a next one. There is no question about it. I think that we need to start by working all together, and we need to get rid of these differences. I mean, this difference in opinion, this is the first time in my life that I have seen them. I mean, let's just sit down together. Let's be reasonable. Let's talk. Let's try to develop a contingency plan. We may not all agree in efforts, but there needs to be some negotiation. I mean, simple as that. I see my colleagues that do something completely opposite. They are not even willing to open a conversation. They are not willing. I mean, it's like, absolutely not. What you guys are doing is crazy.
Yeah. So I'm going to end with a little bit of self-promotion. I have a book as well. I've got a couple others not yet published, but you're one of the people on earth who has read my book. This is Overturning Zika, the Pandemic That Never Was. It's got my picture on the cover. And it's about a phenomenon that people may have forgotten. It was the biggest medical news story in 2016, not that long ago. And I'm going to, let people kind of look into this a little bit. But here as well, people were told to, in this case, stop having babies until there's a Zika vaccine. And this is, I'm just going to say that a lot of it was exaggerated. There hasn't been any Zika-related microcephaly on Earth since then. Zika is a real virus. It's a dengue virus, mild. And microcephaly is a real problem, small heads for babies. But they don't seem to be related. But the experts are not always right. And some of their measures and seem to be too far in the world of their realm of safety, what I call safetyism, and having people do nothing while they figure things out. And sometimes they don't even figure things out. And sometimes when they do figure things out, they're actually wrong in the way they did it. I don't know if you have any thoughts about the book that you want to share with people before.
Yeah, I mean, I had the opportunity after you gave it to me for free, which was nice. I had the opportunity to read it. I was impressed. I mean, and it's interesting that you and me were talking about this before we went on the air. And it's like, one of my kids was thinking about going to a vacation and was concerned about the Zika virus, and because she's pregnant, it's like, come on. And it's like, let me tell you a couple of things. I mean, so to be honest with you, even as a healthcare provider, your book was eye-opening. Was eye-opening because I can assure you that 99% of my colleagues are going to keep on thinking on that microcephaly that we're talking about. Doesn't matter. The question is, how do you, other than with your book, how do you educate all those clinicians? This is, the same thing that we're going through with the COVID virus. Exactly the same thing. We just need to find platforms that allow us to explain these things. And I think that what you're doing right now, with this platform, hopefully it will reach out some of the.
All right. So I'm going to ask you one favor before we go. You can deny it if you like, but there's a doctor in Houston named Peter Hotez, and he's interested in tropical illnesses, and he's at Baylor, I believe. If you are done with your copy and you want to pass it along to him, I'd love to get his thoughts on this, and maybe you can just tell him either before or after, what your thoughts were. That would be a favor for me. It would be interesting. I've sent him a couple notes. He answered one initially that he was busy. He'll get back to it, but COVID was too busy. But COVID's died down. He still hasn't responded. So we went to the same college. We both went to Yale College. I think he's a couple of years younger than I am after me. But I think we have some mutual contacts. Anyway, I'd love to hear from him back on this. Maybe, you can extend an invitation on my interview show for him as well. But I know he's a hard guy to get a hold of. He's probably very, very busy, and I'd be way, way down on his chain.
I'll be happy to do that. I actually know, Peter, I know that we have completely opposite points of views in several things. But believe it or not, we're collegial with each other. That's one thing that has really been impressive throughout all of this pandemic. I mean, I see Peter from time to time, and we talk. I tell him my points of view. He tells me his points of views. We are collegial. Yes, he disagrees with the use of, for example, ivermectin, and I disagree with some of the things that he has. But we are. This is the one part that I wish everybody did. You can talk to each other. It is unreal that we are not able to do this, even though we're all professionals.
Yeah. Well, thank you so much for your time.
My
I'm going to say goodbye to everybody else. Thank you, so Joseph. I appreciate it.
My pleasure. Thanks for the invitation, and I look forward to seeing you in the near future.
All right. Bye.